Every day, 9 Canadians are diagnosed with multiple myeloma. Although there is no cure yet, we've made tremendous advances in science and treatments where patients are living longer and better lives. 15 years ago, the prognosis was grim. Life expectancy was 3 to 5 years. There was no national Canadian patient organization, there was very limited support groups, and there was also very limited information available. It took some very special people to make a difference.
When Aldo Del Cole received a diagnosis of multiple myeloma in 2002, he was shocked at the absence of available information and the lack of clinical trials. He felt alone and frustrated. Determined to change things, Aldo established a local myeloma support group in 2004. There he met John Lemieux, a fellow patient who shared his vision to build a strong community for everyone impacted by myeloma. Their passion resulted in the founding of Myeloma Canada in 2005, the first patient-driven Canadian organization committed to improving the quality of lives of all Canadians touched by this incurable blood cancer. Myeloma Canada is a grassroots organization driven to empower patients, caregivers, and researchers. We bridge the gap between the community, stakeholders, and clinicians and raise funds for advancing awareness, education, research, advocacy, and community empowerment.
Myeloma Canada has been a very active advocate for patients, both in raising awareness of the disease in public and in fundraising for the activities that they pursue. It's been active in the scientific community by bringing together clinicians and researchers from across the country, and its patient advocacy has clearly made a major difference for drug access and public awareness of the disease.
We began by raising awareness of this little-known yet devastating disease. The inaugural Myeloma Canada National Conference was held in 2005. It was the first time that patients, caregivers, and healthcare professionals from across Canada came together to learn about the disease and its management. Today, our conference attracts more than 250 participants each year. Since the beginning, we've hosted hundreds of educational and community events, created countless online and print resources, and continue to develop award-winning support tools. In 2018, we led the creation of a Consensus Guidelines Consortium, resulting in the publication of the first guidelines on the diagnosis of multiple myeloma and related disorders in 2020, designed for healthcare professionals.
When we diagnose myeloma, often we guide them to go to Myeloma Canada website, because there they can find the information that will allow them to go through the process of treatment, understanding more about the disease, watch webinar that they find extremely helpful.
I think it's a great asset for myeloma patients, providing them with education and support after their diagnosis and throughout their treatment.
It's very important for people to support and donate to Myeloma Canada, because it's heading towards hopefully a cure, and if it's not there for me, then hopefully it will be there for people in the future. But it's also leading towards great new treatments that are extending people's lives and improving the quality of their lives.
By connecting researchers and clinicians, our collective understanding of myeloma grew by leaps and bounds. In 2009, we assembled many of Canada's top experts for the first Myeloma Canada Scientific Roundtable. From its humble beginnings, the Roundtable now draws more than 120 attendees for knowledge sharing and serves as an incubator for research ideas. Alongside Canadian myeloma experts, Aldo Del Cole helped co-found the MCRN, bringing together clinicians to advance innovative research. The MCRN has initiated many clinical trials, and in 2016, Myeloma Canada supported it as it became a standalone organization. The MCRN is now rebranded as CMRG and is looking forward to the future. We also contributed to the creation of 2 university research chairs in multiple myeloma, one in Toronto, the other in Montreal, and provided many grants for Canadian researchers. Now we're spearheading the first priority-setting partnership for myeloma in Canada, a program that uses patient input to identify research priorities.
I got connected to Myeloma Canada through being diagnosed with myeloma in 2009. I've had so many amazing advocacy opportunities. We've done awareness days at the Alberta Legislature. We've done awareness days at the Parliament building, opportunities for patients to get together and to advocate for better care, to advocate for access. You know, it's just empowered me to be a little bit more astute in managing my own disease. Everybody, the whole Canadian myeloma community benefits from this organization.
While research is paramount, it has little benefit for those in need if they don't have access to the innovations. We've been playing a key role in bringing access to essential drug therapies to Canadians since 2006, starting with advocating for Velcade funding and then later providing a government agency with patient feedback for drug funding decisions. Today we have many robust advocacy programs from the local to national level. These efforts have drastically changed the myeloma landscape, taking us from one approved drug in 2005 to over 8 available drugs today, including another new one in June of 2020. Our goal is to drive change in the healthcare system by advocating independently or partnering with Canadian and international patient organizations and coalitions.
This is a disease, multiple myeloma, that most people have never heard of until they or someone they know has been affected by it, and that sense of community that the organization provides to patients is invaluable. It's remarkable that a group of patients has really led the galvanization of the Canadian myeloma medical community. Money raised through Myeloma Canada will go towards advocacy for patients with myeloma and awareness and education of the disease and to support research.
As our reach grew, so did the need to provide the myeloma community with peer support. Where only 8 Canadian support groups existed in 2005, we now work with a network of over 44 groups across all 10 provinces. The first walk to support myeloma was held in 2009 to bring awareness to the disease and create stronger local communities. Since then, it's evolved into our flagship national Multiple Myeloma March, bringing together thousands of patients, caregivers, families, and friends.
We wish Myeloma Canada a happy 15th anniversary, and most importantly, we wish them for the next 15 years continued success, and hopefully they can continue to provide the wonderful support they provided for the myeloma community, patients and their families.
I wish nothing more than for people to realize, take a step back and say, wow, the vision that was had 15 years ago and where this organization has gone from the very beginning to where they are now, I think is magnificent. And I can only wish that much more growth and that much more recognition for the benefit of patients.
Myeloma Canada has evolved into an internationally respected organization, and we will continue to empower patients and the people affected by this disease until a cure is found. We are at the dawn of very exciting times. With new treatments and research coming out every day, we need to keep the momentum going, and with your help, we can make it together.